When a patient has bypass surgery or a heart attack or a stent placement, they usually leave the hospital and go home.
We can get people not unusually out day 3 or day 4 off to rehab, and it's not, these are people in their 70s and 80s, and that gets them moving, and it makes a world of difference.
If they're elderly and they need a little more assistance, then they will go to JML or Spalding or someplace for usually a week, and then they'll go home. Then there's a period of time that the patient is waiting to go back to see their physician to get clearance and get a referral for cardiac rehab. So that's usually about 6 weeks, 6 to 8 weeks.
Cardiac rehab is a program for patients to get back on their feet again, basically. It can be after bypass surgery, after having a heart attack, after having valve surgery.
One of the things we tell the patients when they come in is that it's a program that's for each patient as an individual.
The goal of the program, the cardiac rehab program, would be to get people back on their to a regular lifestyle, and oftentimes a lot more healthy lifestyle than they did before.
Some people are able to do more than others, and we start them very low-level exercise so that they can progress, and that's how they start to build their confidence again, because it's like, okay, I can do this, it's going to be okay, because they're usually pretty frightened. It's a time when they come into the program that they've had a pretty traumatic psychological event take place in their lives, and for them to come in and start taking charge of themselves and their health and what they eat and quitting smoking and so forth is a great thing to watch these people change.